Have you ever thought that the medications you take to improve your health might actually harm your brain? It may sound surprising, but some common drugs, taken by millions of people every day, are linked to a serious risk of dementia. These medications may help treat other conditions, but they can silently affect your memory and cognitive function. Today, I'm going to tell you exactly which drugs pose this risk and what you can do to protect your brain health. Stay with us until the end of the video. There's also a natural alternative method that might help you manage your conditions without harming your brain. Certain medications, particularly those with anticholinergic properties, block a crucial chemical called acetylcholine, which is essential for memory and learning. When drugs interfere with this chemical's function, they can gradually damage the brain. For example, proton pump inhibitors, PPIs, such as omeprazole, which are used to treat acid reflux, have been shown in studies to be associated with an increased risk of dementia when used long-term. Before stopping any medication, always consult your doctor. But it's important to be aware of these risks. We've discussed a natural treatment for acid reflux in a popular video based on a doctor's prescription. Check it out. Now let's talk about anticholinergic drugs. These medications block acetylcholine and are used to treat a range of conditions, from bladder issues to Parkinson's disease. They may be effective, but they come with a major downside. Long-term use is strongly linked to dementia. A study conducted at the University of Washington tracked over 3,500 older adults for 10 years. Those who regularly took anticholinergic drugs had a 54% higher risk of developing dementia. Common examples include diphenhydramine, used for allergies or sleep, and oxybutynin, used for bladder control. If you're taking these medications, talk to your doctor. There may be safer alternatives that don't carry these risks. By the way, if you've ever taken these drugs, how did they make you feel? Have you noticed any changes in your memory or focus? Please share your experiences with us. Next, let's discuss corticosteroids, such as prednisone, which are commonly prescribed for inflammation, asthma, and allergies. The problem is that long-term use can cause structural changes in the brain, leading to issues like confusion, memory loss, and even an increased risk of dementia. A large UK study involving over 500,000 people found that those who used corticosteroids long-term had a significantly higher risk of dementia. This is because corticosteroids can alter levels of cortisol, the stress hormone. When cortisol levels remain elevated for extended periods, it can damage the hippocampus, the part of the brain responsible for memory. If you've been using corticosteroids for a long time, it's critical to regularly review your treatment with your doctor. They may be able to reduce your dose or explore alternative treatments to minimize these risks. Now, let's move on to benzodiazepines, such as Xanax, alprazolam, and Valium, diazepam, which are often prescribed for anxiety and insomnia. These drugs can be very helpful in emergencies, but long-term use can double the risk of Alzheimer's disease. One study found that over 80% of people who used benzodiazepines long-term experienced significant neurological symptoms, including memory loss, difficulty concentrating, and heightened sensitivity to sensory stimuli. These drugs can damage the brain's neurotransmitters, leading to lasting changes in brain function. If you or a loved one have been using benzodiazepines for an extended period, consider non-drug alternatives like cognitive behavioral therapy or relaxation techniques. These methods can help manage anxiety without the long-term risks. And here's something surprising. If you've ever used Benadryl, diphenhydramine, or other first-generation antihistamines for allergies, these drugs are also linked to an increased risk of dementia. While they're effective at relieving symptoms like sneezing and nasal congestion, as I mentioned before, acetylcholine, a critical neurotransmitter, is blocked by these drugs. A study that reviewed 138 studies found a strong link between long-term use of first-generation antihistamines and cognitive decline. Patients who regularly used these drugs experienced memory and concentration problems even after discontinuing them. The good news is that safer alternatives, such as second-generation antihistamines like loratadine, are available. These provide similar effectiveness for relieving allergy symptoms without the brain-related risks. Now let's talk about tricyclic antidepressants, such as amitriptyline. These were among the first drugs used to treat depression. While they've helped many people, they come with serious side effects, including memory loss and cognitive impairment. Research shows that patients who regularly use these antidepressants experience a faster decline in cognitive function compared to those who don't. This risk is particularly pronounced in older adults. The reason is that these drugs have strong anticholinergic effects, blocking neurotransmitters essential for memory and learning. If you're using tricyclic antidepressants, it's wise to discuss alternative treatment options with your doctor. Finally, let's discuss statins, such as atorvastatin and simvastatin, which are prescribed to lower cholesterol and prevent strokes and heart attacks. Research evidence suggests that individuals who use statins long-term may experience issues like memory impairment and mental confusion. It's believed that statins disrupt cholesterol production in the brain, which is essential for neural connections and brain function. Some over-the-counter OTC medications can also increase the risk of dementia. Drugs like sleep aids and allergy medications, when used long-term, can be as dangerous as prescription drugs. For example, diphenhydramine, found in some over-the-counter sleep aids like Unisom, is linked to reduced cognitive abilities. You might think that because these drugs are available without a prescription, they're safe. But their risks are very real and serious. Always read the labels of over-the-counter medications and consult your doctor before using them regularly. There are natural alternatives that can help you manage these conditions without harming your brain health. 1. Melatonin for insomnia. If you're using drugs like benzodiazepines or sleep aids containing diphenhydramine, try melatonin instead. This natural hormone helps regulate the sleep cycle and has been shown to improve sleep quality without affecting memory or brain function. 2. Chamomile tea or valerian root extract for anxiety. If you rely on drugs like benzodiazepines for anxiety, consider trying chamomile tea or valerian root. These have been used for centuries to promote relaxation and reduce stress without the risks of dependency or brain damage. 3. Ginger or apple cider vinegar for acid reflux. If you're concerned about long-term use of drugs like omeprazole, ginger and apple cider vinegar are natural remedies that can help reduce acid reflux symptoms. 4. Mindfulness and relaxation techniques. Instead of relying on medications for stress or anxiety, try techniques like mindfulness meditation or deep breathing exercises. These have been shown to effectively manage stress and improve mental health without the side effects of drugs. Being informed and proactive can help you make better decisions for your long-term health. If you're taking any of the medications mentioned, don't panic. The solution is to talk to your doctor about the risks and benefits of these drugs and explore safer alternatives whenever possible. The role of the gut microbiome in brain health. Have you ever considered that the bacteria in your gut could act like guardians protecting your brain? These bacteria, known as the microbiome, are like a tiny army in your digestive system. A 2024 study published in the Gut-Brain Journal showed that a healthy microbiome produces substances like short-chain fatty acids, which reduce brain inflammation and enhance memory and focus. The gut-brain connection and dementia risk. If your gut gets out of balance, say, from eating too much fast food or being stressed, those beneficial bacteria weaken and the risk of dementia increases. What can you do? Eat foods rich in probiotics, like natural yogurt, kefir, or even homemade pickles. Fiber-rich vegetables like cabbage Carrots and spinach also keep these bacteria happy. A study found that following a probiotic-rich diet for 3 months can reduce the risk of dementia by up to 20%. Plus, a healthy gut even boosts your mood, since 90% of serotonin, the happiness hormone, is produced in the gut. If you want, you can try probiotic supplements, but it's best to check with your doctor first. What gut-healthy foods do you eat? Share them with us in the comments. New technologies for brain protection. Imagine putting a small device on your head one day, and your brain gets an upgrade like a computer. Scientists are working on cutting-edge technologies that can boost your memory and focus without drugs. One of these is transcranial magnetic stimulation, TMS, which uses magnetic waves to activate specific parts of the brain. A 2025 study in Neuroscience Today showed that 20-minute TMS sessions can strengthen the hippocampus, the brain region that controls memory. This method is already used in some clinics for depression, but researchers say it could soon become common for preventing dementia. Another option is brain training apps like Lumosity, which offer games like puzzles or memory tests to strengthen neural connections. Even new smartwatches are adding brain health monitoring features that tell you when your brain needs a break. These technologies aren't widespread yet, but they're very promising. If you could have a brain-boosting gadget, what would you want? Let us know in the comments. The importance of mental activities for dementia prevention. Your brain is like a powerful machine. If you don't use it, it rusts. Recent research, like a 2024 study in Alzheimer's research, shows that mental activities can reduce the risk of dementia by up to 30%, even if you're taking high-risk drugs like diphenhydramine. What are these activities? Things like solving crosswords, learning a new language, playing an instrument, like the guitar or piano, or even painting. These tasks help your brain's neurons form new connections and strengthen the hippocampus. Another study found that people who engage in mental activities like chess or reading for 20 minutes, 3 to 4 times a week, can delay dementia symptoms by up to 10 years. Plus, these activities don't just benefit your brain, they improve your mood and reduce stress. You don't need to do anything complicated. Even listening to educational podcasts or playing simple games like Sudoku is enough. Just 15 to 20 minutes a day is all it takes. Sounds easy, right? What mental activities do you enjoy? Share them with us in the comments.